Today we'll be talking on infarction, the etiology and pathophysiology will be discussed by Kastori and Sana, the risk factors discussed by Akash, diagnostics by Zaira, and treatment by Zubeda. So what is infarction? Infarcts are wedge-shaped. It's an area of tissue damage or death due to lack of oxygen caused by an obstruction, commonly thrombosis, blood clot, which narrows the blood vessel. Factors that affect infarction, these are distinguished by the presence of microvalve infarction, arterial obstruction, venous obstructions, with less common occlusions like atheroma expansion, a tumor, vessel twisting or constricting, or circumscribed edema. Red infarcts is caused by venous obstruction in loose tissues with double or collateral circulation like the brain, lung, and testes. Due to the venous outflow being slow, there's an accumulation and a congestion of red blood cells, and the fibrin strands creating plaque, and the redness of this infarct can be reperfused. White infarct is caused by arterial obstruction in the heart, spleen, and kidney due to arterial end circulation and the density of the organ, as it restricts the discharge of blood from adjoining patterned vascular bed, limiting the oxygen, glucose, nutrients, causing it to be anemic. Septic infarct occurs in spleen, kidney, targeting vascular obstruction as it relates to the microvalve infection. Leukemia infarct accounts for 25% of ischemic strokes as it relates to hypertension due to an obstruction of a single deep penetrating artery. Infarcts last from about a day to a week, swollen with excess amount of fluids, whereas subacute lasts from a week to a month. By then the tissue is damaged and liquefactive necrosis occurs, and chronic starts from about a month, which prior to treatment, as seen from this image, a scar forms. Myocardial infarction occurs due to an unstable collection of macrophages, inflammatory cells, proteins, lipids that build up, forming a sclerosclerotic plaque in the heart. This decreases the pumping function of the heart, damaging the heart muscle, giving an irregular heartbeat. This is a heart attack, and the total damage of the heart muscle is determined by the size of the blockage and the time taken between the injury and the treatment. Cerebral infarction occurs due to the blood vessel supplying oxygen-rich blood to the brain being blocked by a blood clot. Ischemic stroke is subdivided into two: thrombotic stroke caused by blood clot, and embolic stroke caused by wandering blood clots that travel to the brain, formed from another region due to atrial fibrillation, resulting in death of irreplaceable brain cells, is the third most leading cause of death. Pulmonary infarction occurs due to a shortage of blood supply to the lung tissue as a result of the blood vessel occlusion, such as air bubbles in the bloodstream, cancerous tumor fragments, and thrombosis. This is a worldwide distribution, showing China, Africa, Argentina, and America to be the highest with regards to myocardial infarction and cerebral infarction, as 80% of cases are ischemic stroke.
Modifiable risk factor, tobacco smoking. The chemical components of tobacco damages the interior layer of the human, which is the endothelial cell. Cholesterol, fat, and calcium ion in the blood gets deposited at the site of injury, and it narrows the human, constricting blood flow and increases the risk of clot formation. High blood pressure causes shear stress on the endothelial cell. A high level of LDL in the blood accumulates faster at the site of cell injury and speeds up the risk of plaque formation. Also, there is no direct relationship between diabetes and infarction. However, there is a study which shows that a person who has diabetes is more likely to get infarction. Infarction can be prevented by having a balanced diet. Eating food such as fruits and vegetables and eating less sugar decreases the amount of developing diabetes. Also, eating low salt level reduces the risk of high blood pressure. Eating more fish increases the amount of high-density lipoprotein cholesterol in the body, and eating less meat will help reduce the amount of low-density lipoprotein cholesterol in the body. Lack of physical activity makes the heart work faster, tighten the arteries, and increases blood pressure. Alcohol brings in unnecessary calories in the body and increases the risk of diabetes. Stress is not a direct risk factor, but it contributes in increasing blood pressure. Non-modifiable risk factors such as family history, gender, age, and ethnicity has been further discussed in the wiki.
Infarction is caused by a blockage in the coronary artery due to plaque formation. This is usually a result of atherosclerosis. There are two main coronary arteries, each has a special function. If one of these arteries becomes blocked, they reduce the pumping ability of the heart. This results in ischemia and necrosis occurs. Necrotic damage is irreversible as the heart itself is myogenic. If artery regulating heartbeat becomes blocked, it causes irregular heartbeat. This condition is known as cardiac arrhythmia.
Cerebral infarction is subcategorized into 4 different sections according to their causes. Another type of infarct is a lacunar infarct, which is caused by the thickening of the cell walls in the brain. Pulmonary embolism is a major cause, especially the thrombi, originating due to venous status from the lower region of the body.
The heart is responsible for pumping blood to all parts of the body for circulation. The coronary arteries branch off the aorta and are located on the surface of the heart. Their role is to deliver oxygen-rich blood to the heart muscles. Atherosclerosis is a result of atherogenesis, which is the accumulation of fatty acids or cholesterol, cellular waste and calcium. The cholesterol molecules become oxidized, initiating an immune response. Immune responses cause the body to send macrophages to the location of fatty deposits on the blood vessels. The macrophages surround the fatty acids in an attempt to destroy it by means of endocytosis. The cell becomes filled with lipids, giving it a foamy appearance, such as here. This thrombus occludes the artery and, if detaches, causes an embolus to form. This narrows blood flow to arteries and decreases pumping ability. The myocardium becomes starved of oxygen, resulting in necrosis and irreversible cell death. These build up in the inner lining of the arteries, causing plaque formation. The high lipid buildup causes the artery to rupture and activates clot formation, known as the clotting cascade. This is where calcium ions stimulate the release of prothrombin and converts it into thrombin, which alongside platelets form a stable mesh network via agglutination, producing a collagen scar.
Blood flow is important because the brain is aerobic, thus requires oxygen from the blood to flow through to produce ATP through oxidative phosphorylation. There's thrombotic infarcts or embolic infarcts. Thrombotic infarcts are caused by blood clots within the brain, while embolic infarcts are caused by travelling by.
Infarction occurs in vessels of whose diameter is 3 mm occluded or more. This occlusion results in an embolus forming. This embolus increases pressure in the bronchial arteries, which supply O2 to the parenchyma.
In the anterior chest, dyspnea and nausea are possible symptoms. They are diffuse, unaffected by movement, and persist for at least 20 minutes. Blood markers creatinine kinase NB, myoglobin and troponins are measured. Echocardiogram, in which sound waves are transmitted as electrical impulses, create images of the heart, highlighting poor blood flow. Elevated cardiac markers are interpreted in the context of clinical and ECG findings, which interpret the heart's electrical activity. If ischemia is undetected, the ECG, especially the inferior leads, are vital, as they indicate ST segment elevation. If this takes time, an initial ECG may be inconclusive. Ischemic causes of ST segment elevation result in overtreatment. Symptoms can be misdiagnosed as gastrointestinal, common in young people. Symptoms are dependent on the location and extent of ischemia. Facial weakness would be caused by damage to the cerebral hemisphere. CTs take detailed images determining the extent of bleeding, ruling out hemorrhagic causes that clinically mimic infarction. If inconsistencies with clinical and CT results arise, MRI, which detects changes in brain tissue, is performed. Angiography, ultrasound, listening to carotid arteries also support diagnosis. Ischemia is detected due to edema, a consequence of the failure of iron pumps. As is the cerebral artery and there's involvement of grey and white matter, also typical of infarction, the diagnosis is cerebral infarction. Few symptoms that are specific to pulmonary infarction are rarely encountered, so the diagnosis is often missed. Pleuritic chest pain indicates peripherally located emboli, as deep tissue infarction seldom causes pain. Chest x-rays identify changes in blood vessels and signs of tissue infarction. As white blood cell counts and sedimentation rates are elevated, blood tests also assist. CT allows vascular structures and occlusion to be seen. Physical findings are subtle in those who better tolerate hemodynamic changes.
Myocardial infarction treatment, ACE inhibitors, which is given to patients in 24 hours after myocardial infarction has occurred. It reduces the high blood pressure, also decreasing the workload of the heart and increasing the blood flow. Thrombosis therapy decreases the blood pressure and increasing the blood flow. Also, it is used in lung and cerebral infarction. Anticoagulants reduce the formation of the blood clots by helping. Helping reduce the blood clotting by inhibiting an enzyme in myocardial infarction. Angioplasty, this treatment is processed when the artery is blocked and is only used in the hospital. Anti-platelet drugs such as aspirin reduces platelet aggression and inhibits thrombosis formation. IV nitroglycerin is given to patients in 48 hours after the myocardial infarction has occurred, and increases the blood flow and decreases the pain. Also, it reduces the workload of the heart. Treatment for pulmonary infarction. Streptokinase and plasminogen prevents blood clotting. It also reduces the chance of having another stroke, and also it can prevent the patient having disability. Venous curve filters, it is performed in hospital by surgery. Treatment for cerebral infarction. The main purpose for this treatment is to block the inflammatory responses with not blocking nerve impulses. Intravenous thrombolytic can take up to 1 hour, dissolving the blood clot, also reconstructing the blood flow. Corticosteroids decreases the cerebral edema. This treatment decreases the neuronal metabolism. Also,
General prevention for infarction is to not smoke, to have a balanced diet, to be physically active, to not drink, and to manage stress. A specific prevention for myocardial infarction and cerebral infarction is drug therapy and this has been mentioned by my friend Zubeda. For pulmonary infarction, anticoagulants, compression in stockings, and increasing mobility helps in preventing the formation of a blood clot.